This presentation is co-production between GGD, which is the Association of the Public Health Centers in the Netherlands, regional organizations, 25, and Topicus. At Topicus, we have a booth there. It's very yellow all around. There's my colleague waving. And we are a software firm in the Netherlands with offices all over the country. And we have 900 employees and are fully focused on healthcare. And that's the next slide I'd like to say. It's already there. So our vision, our idea is that the patient first, so value for the patient, that's the only thing that matters from the birth of a person till the person is elderly and will be in elderly care. We do that connected between healthcare professionals, so that is a very good examples between primary care and secondary care. We have large projects in mental health care where people from secondary care cooperate with primary care healthcare professionals. And last, we also support healthcare insurance companies for value-based healthcare. Well, this is what we are, and I'd like to introduce Carolien. Carolien is a professional already, over 30 years involved in TB in the Netherlands. She was in various roles involved, so project management, coordinated one of the largest regions in the Netherlands on TB, and knows all about the nationwide software platform for screening and treatment. So, Carolien, give it a go.
Okay, thank you. Thank you, Ronald. Well, iTBC, a Dutch countrywide information system for TB control. Here symbolized as roundabouts with the National TB Electronic Patient Record, which are used by all TB departments in the Netherlands. It facilitates an effective and efficient organization of TB control, supporting regional and national cooperation. Laboratories, GPs, the institution for detained, asylum seekers, hospitals, etc. An information system with easy access, anytime, any place, any device. Information whenever and wherever you need it, independent of time and place. Fully integrated with the countrywide image management system for lung X-rays. A system compliant with newest local Dutch and European laws and regulations. The next minutes I'd like to tell you why we develop a new system. What are the enablers for future TB control, the basics of the TB system. Then I will explain what iTBC is and what it means. And last but not least, the story of our road to success. In a low prevalence TB country, it's important to maintain sufficient expertise and capacity. In our national tuberculosis control plan towards elimination was described how the 25 TB departments start to cooperate in 4 public health TB expertise centers. In view of ongoing and anticipated developments in tuberculosis and tuberculosis control, further scaling is necessary and create a single national expertise center with national governance for TB. iTBC, as the National Information System for TB Control, based and built on the national protocols defined in the Netherlands Tuberculosis Control Policy Committee, the CPT, facilitate central governance. Possibilities for constantly monitoring and evaluation of screening and treatment will contribute to prevent TB. We developed standardized definitions and questionnaires based on the previously appointed national protocols for TB screening, such as risk group policy, source and contact tracing, interferon gamma release assays, screening of latent tuberculosis infection. TB needs a process-driven central information system with a high quality of data, even historic data. In the old system, we held records of more than 3,330,000 clients. This system must enable paperless working, needs an open architecture based on international standards, comply with newest, as I said before, local Dutch and European laws and regulations. There's a role-based access control using team metaphor and information security standards like two-factor authentication. And functional management of iTBC is centralized. Base of all is an electronic patient record. A client or patient shows personal data, medical information about all tests, diagnosis and potential treatments, etc. This electronic patient record has links and is integrated with the following modules. An integrating planning system to make all appointments in an intelligent way, even group-wise. The TB information system is fully integrated and linked with the image management system for X-rays of the lungs, built by Old Delft. X-ray orders are automatically sent to the X-ray modality as soon as the client has been registered. The X-rays can be viewed and evaluated in iTBC immediately after they have been made. And TB doctors, they open the order overview and can detect possible active diseases. At the moment they read for one or several teams. Sometimes doctors forgot to select their own team, so they evaluate all X-rays of the Netherlands. So the system is ready when starting a more central organization. Lab Online supports the user in processing, requesting and viewing laboratory test results. The module for contact tracing. Each health record can be added to one or more contact tracing, whereby a table is generated which includes individuals with their personal characteristics and examination results. The affected person table then provides doctors and nurses with real-time information on these persons' relation to the index, X-ray, MAN2, IGRA results and diagnose. The goal here is to monitor research progression and assess whether there is a need for up or down scaling the intensity of contact tracing. In order to burden the care provider as little as possible with the financial settlement of the care provider, iTBC uses the electronic declaration portal FinControl. And an intelligent reporting module is included. Monthly overviews are made to analyze data and report them to monitor and prevent the further spread of tuberculosis, to count all examinations and to possible adjust the protocols of screening and treatment. What was our road to success? iTBC was and is a co-creation in public-private partnership, and a lot of institutions cooperate. This infographic shows the project governance with working groups. Participation of a lot of professionals, a focus group to develop, implement and start iTBC. There was and is a high commitment of all people involved. There was converted, as I said before, 3,330 historic files. We communicate to all staff members of the paradigm shift to a nationwide TB system, totally different from the previous system. 250 staff members working on 25 TB departments started on the same day after a weekend of conversion with iTBC. A website was available with easy access to all documentation, frequently asked questions, forum and daily updates. Topicus and key players give floor support and follow-up care. Evolutionary development is ongoing. First, we must change and work with a new system. Now it's important to keep the paradigm shift and want to work with iTBC. A nationwide IT system for TB facilitate and ask for a nationwide organization of TB control. The horizon is nearby. Integration with LRCB, the Dutch Expert Center for the Quality of Screening. Integration with OSIRIS, the report system for infection diseases of the RIVM, the Netherlands National Institute for Public Health. Integration with the nationwide system for asylum seekers. I dream of further development. Import of the detained automatically. Planation of the mobile X-ray unit who visit all prisons. Report results nationwide. Link with the immigration service. And work decentral where there's a need, and work and organize nationwide when it's possible. Such as nationwide electronically informing GPs about the vaccination against TB, and nationwide view and evaluate screening X-rays. There's more than 100 years of experience in registration of TB, starting 1903 in handwritten files all over the Netherlands, towards digital reports in 25 DP departments and 4 regions. Now use the possibilities to gather data and analyze it in one center for TB control. The horizon is nearby. And for more information, you can come to the booth and speak with the men in yellow.